For the final project, I have chosen to interview a health professional who is involved in telehealth, and I chose to interview Stephanie Klassen. Stephanie is a licensed marriage and family therapist, and she owns her own practice. With Stephanie living in Olathe and making it harder to meet in person, I was able to set up a virtual platform for us to meet. Stephanie started her own practice in Waco, Texas, and has since moved to Olathe, Kansas. Because she has a virtual meeting platform, she was able to keep all of her same clients. The platforms that Stephanie uses when meeting with clients is a video chat or an audio-only call. Stephanie mentioned that some patients feel more comfortable when they do not have to see somebody's face when communicating. They can just hear a voice and know that somebody is listening. When talking with Stephanie, she mentioned some of the positives and negatives with the meeting with clients virtually. Some of the positives about telehealth are working from home, allowing patients to feel more comfortable while being able to talk in the comfort of their own home, and saves patients travel time. When needed, the client can show their home environment, and Stephanie can use that to help improve their treatment plan. By being able to see inside the patient's home, Stephanie can have more ways that she is able to help the patient. If they were to meet in person, Stephanie would only be able to hear a description of their environment. Some of the downsides about telehealth would be it is hard to meet with the kids virtually. When Stephanie meets with kids, she gives them toys to play with, and you cannot do that through a screen. Another downside is that some people might lose their connectivity during the meeting, and it is very hard when you're in therapy with someone and you have to ask them to repeat what they have said. That does not go over well most of the time. Some of the ways that Stephanie keeps up to date with all of the laws and regulations and everything with the practicing telehealth is by taking continuing education courses. The overall idea of telehealth improves patient care. By allowing the patient to meet in the comfort of their own home is huge, especially during COVID times. For the patients who did not want to go out and risk their own health, it still allows them to get the care that they need. Patients are willing to share more when they are in the comfort of their own home. By meeting through a screen, it takes away some white coat syndrome that some patients might have. It also saves the patient travel time, and it can allow them to meet 1 hour during their lunchtime or something, when not having to go out and make a whole other time to meet. They can take time out of their own day to do it. One other possible downfall to meeting virtually is that you might not get the best patient care. With the clients that Stephanie meets with, it is a perfect platform to meet for them virtually. But if you are actually sick, you might consider meeting in person with your healthcare provider, because they would be able to give you a better diagnosis or better course of treatment.